Good morning, everybody. Welcome to the live streaming session where we are going to be discussing the weekly exposure rating and the daily screening tool. We're still waiting for others to join us, as I can see how many people are online. So as we are waiting for them, we will be giving them another 5 minutes, and then we will be able to stream going forward. Hi, Peter, how are you? Yes, are the people going to be joining? I see there's only one person online joining. Click on that. All you do, you click on that link. There's a link anywhere where you see it. Just click on the link. Vimeo. Yes, you see that video itself. That if you click on it, it will take you. Yes, and then it will say live streaming or the event has started. Okay, so you see the advertising that currently is happening, the children coughing and all that. Ah, okay. So can you help everybody to actually do exactly that? So that they can be able to join us. I see there's only one who was able to join. I'm not sure, so we are going to wait for them. Yeah. No problem. I will see as they join. Thank you, thank you. I think we're going to continue simply because everybody else will be joining us as and when we continue with our live broadcast. We are coming to you, especially as a client of ours, and we are going to be going through the process of what is expected from you guys going forward. What has been happening is that we have already given you the access to our system, which system is literally the health eMR. What it stands for, it's the health electronic medical records. And in a way, what we are doing is we are saying we want you guys to be comfortable with ensuring that you can be able to do the COVID-19 daily screenings, which are in law a must for all employers. We need to ensure that at all times, everybody is comfortable with the system. So this is what we are going to be doing. We are going to be putting on the screen the system itself, but also as we go along, we are going to be opening up the chat so that at least everyone who wants to be able to chat to us can be able to talk to us and or send information or questions. So when you see a chat box opening, all that it means is that you can be able to start asking questions and or send information. Let me just sending out this request to you so that you can be able to join in the chat whilst watching the online live streaming. So this is how it will appear on your screens as and when this chat is open. It will say, as I've just put on there, if you respond to that sending out request to join chat, you will be able to chat to us. We are also going to be opening up at some point or at any point any questions that might come from you. So you're welcome to send us requests and or questions that you want us to answer. We have put together this module of the electronic medical record. The electronic medical record is actually capable of doing more than just what we are talking about today, which is the COVID-19 screenings, as well as the COVID-19 exposure ratings. If you are going to have a look at these two, what will be happening is that this exposure ratings tool is a weekly tool, once a week, and it implies simply that after you have been off, you will have to fill in this exposure rating tool in order for it to generate a report as to what risk do you have of either having been exposed to COVID-19 and or yourself having met with people who might have had COVID-19, which in itself will make you a possible exposure risk. Now, we need to understand that risk does not mean you have COVID-19. We need to be able to ensure that we can ascertain the risk we then take precautionary steps in ensuring that that risk is mitigated for, so that we can be able to ensure that we know whether or not we need to take somebody from the workplace and into self-isolation and or hospitalization should there be confirmation of COVID-19. But our purpose for sharing this with you as our client is basically to ensure that you understand that since now you have the access to this tool, what we are going to do is that we are going to then allow you going forward to use it. Everybody should be registered. Now, let me go through the process so that it is easy. We started with a company registration, which we did as the employer. Then we went on to send out forms where you guys as employees are now expected to register. You've registered as service users, which implies that you will be able to now have access to some components of the electronic medical record. Now, let us bear this in mind. The access to electronic records does not in itself mean access to all of the tool. No. All it does mean is you have access to the COVID-19 screenings and the COVID-19 exposure ratings. The rest of the tool will be accessible as per client needs and as per what we're using it for. So today, this live broadcast is basically for the employees to understand that what we are doing now is to show them how to access the daily screening, which is very easy. Every morning, you need to be able to submit this. And as an employee of a company, all you have to do is to indicate that you're an employee. The next thing that you're going to do is to look yourself up. And as you look yourself up, you will see that there's a reference number. Now let's go back to that time when you were registering. Because as you were registering, an email came through and said to you that your reference number at all times is. What it means is that you need to enter that reference number in that reference number field. And once you have entered that reference number field, even if you just enter a component of it, for example, you don't have to remember the words or the text before the number. You need to remember only the number. So if your number is 10061, if you're going to enter 61, it will look for all references that have 61 in them. And as you can see, it now has that. And you can click on it. It will call up your details, wherein your name is, but please, I'm using mine so that we can be able to understand that it can call up your details from the database, having first registered. You will not be able to be on this screen if you have not registered. So all the time, you need to first register. But the second thing is, for those that are willing and are going to be accessing this tool outside of employer-employee situations, you will need to have had a full registration so that you can link yourself up to a company. And this company could be your company or it could be your employer. But the most important thing is you link yourself to a company. And that company, as I said, could be various forms. For example, someone who's a sole proprietor is himself or herself classified as a company first, And the second part is you then register as a service user. What it implies is that you will now be able to use the tool and it will link you to the relevant authority. Having done that, all that you have to do on a daily basis is to indicate to us, do you have a fever? And if the answer is yes, you click it. Do you have chills? And what are chills? Chills are those feelings of feeling one moment hot and the next moment cold. There are many terms that many people use depending on the sophistication and understanding. We will refer to these as rigors. But again, we're not using this tool in a manner of being outside of the understanding of people. So we want you to understand that all you have to do is to indicate whether you have chills. Chills being that feeling of either being too hot the one moment and all of a sudden being cold, and then hot again and then cold. And it does not come at any particular time. It can come anytime during the day. Now, we need to also distinguish that chills are not hot flashes. So for those who are of menopausal age, please just bear this in mind that you do not say you've got chills just because you've got hot flashes. If you have the chills, then you tick it. And do you shake with those chills? You indicate. Do you have shortness of breath? You indicate. Do you have muscle aches? You indicate. Do you have a sore throat? Indicate. Do you have a dry cough? Indicate. Have you got loss of taste or smell? You indicate. And do you have headaches? You indicate. Now, I need to remind you guys that there are possibilities that at some point we will add on to this symptomatology such that we can be able to have as many as are classifying or assisting the medical fraternity to diagnose and or suspect COVID-19. It needs to be borne in mind at all times that you are not having COVID-19 just by having the symptoms. The diagnosis of COVID-19 can only be made once you have taken a swab, a nose swab, or a throat swab. And once that has been done, send it to the lab, and the result then comes back. That's when you can be able to be diagnosed with COVID-19. You are not having COVID-19 just by having these symptoms. Secondly, these symptoms only assist us in weighing whether you are well or not well. You will realize that we do not refer to it as being sick because you have not yet been diagnosed. It's about just being well or not well. Then the next part of the tool or the app is you need to enter your temperature there. Now, a lot of people are saying, well, but I do not have a thermal scanner at home. You don't need a thermal scanner. And this is the most important part. You need a temperature, those electronic temperature probes that we used to buy from the pharmacy just for children. It is as good to take a temperature as a thermal scanner. And in actual fact, a thermal scanner used incorrectly will not give us a good result. So you now need to then enter that. So I will enter 37 because I checked mine and it was 37. And then you need to then enter the crude observation we are referring to. How are you feeling generally? You feeling normal? Do you feel like something is abnormal? Or you're not sure? Well, or you might want to classify or specify how you feel. In that case, you just select other and then you enter I feel down. Now, here, or let's say I feel depressed. Then all you do, you continue. As to who has captured it, it is myself. But what it will do there, it will put your email address. So you need to be able to say who you are as you capture this information. It will, by default, always take the time that we started with the assessment. Now, this is very, very easy. As you get to understand it, it is quick. Let's go through it together. I will just reset. Now, here's the thing. Are you an employee? Yes. What's your name? I remember my code is 61 or 10061. I do have fever, I have a sore throat, and I have a dry cough. Whatever I don't have, I leave out. What's my temperature? 37. How am I feeling? I'm feeling normal. And it's me entering this. So the minute I submit, voila, I'm done for the day. I don't have to submit another till the next day. But what should happen next? You will then be receiving a text on your mobile phone that will then indicate to you that you are well or you are not well. If you are well, you will not be referred for further consultation. But if you are not well, the message will come and it will say something like, Dear Casual Nkuna, remembering my name. The results of your screening indicate a suspicion of a sickness. Please schedule your appointment with Dr. It will mention the doctor's name and it will then go on give you the link, which link you will now need to click to consult with that particular doctor. Now, during the registration as a service user, a company would have selected prior to your registration as a service user a particular doctor. In this case, it is Dr. Nkuna for your company. But the company could have another doctor whose details would have been entered into the company registration form. That doctor is the one that is going to be appearing for you to make an appointment with. However, you are within your rights to select your own doctor during the registration as a service user. So, as and when you are registering as a service user, you will be able to enter your doctor's credentials. It is quite important to remind you that you need to ensure that you inform your doctor that you have registered him or her on the database so that when he receives information, he knows his patients have registered him on the database. Certain information will need to be given to you from the doctor. For example, you will need to know his practice number, his council registration number, and the preferred method of him being contacted or her. It is important because if you are not going to enter that information, what will happen is that you will not be able to have it come to you in the SMS when there is a need for you to consult. By default, all consultations are defaulted to Dr. Casual Nkuna. However, that is for companies who have Dr. Casual Nkuna as their OMP. With us, we have a link which appears on the message that says you can now schedule a consultation. We will go through this at some other point, as it forms not the training on how to use the COVID-19 daily screening tool. It pertains to how to book or schedule an appointment with your doctor. So it is quite important that we remember that. However, as and when we conduct training, you will be informed so that you can be able to understand what it is that we are trying to achieve. That is the first part of this tool, which basically is the COVID-19 tool, the daily screening tool. We're now going to go over to the next one, the one that you only feel only after a long period of absence. How long is long? Any time from a day to two is long enough, because during that time, you might have been exposed to other people. And if you have been exposed to other people, you will need to ensure that we can be able to know. And as we know, we can assess the risk. And as we assess the risk, we can exclude the possibility of others getting the exposure as well. Here is what the COVID-19 exposure rating tool or app form looks like. You are, again, a member of a contracted company. You are doing this for the purpose of risk rating for a workplace. And which company are you working for? I am working for that company, and I select according to the company I work for. For this purpose, I will assume I am not a healthcare worker. The personal information that is here, we are going to ensure that all you have to do is to enter the information as is pertaining to your workplace. However, we have the capability to be able to do it quick because it remembers the information that was entered prior to today. Having said that, once you are here and you use a reference number, it will call up your details. From here, what we are looking to do is to understand your travel exposure. The question is, did you travel anywhere? And if the answer is a no, no further questions. But if the answer is a yes, we will want to ask, where did you go? Were you traveling internationally or domestically? If you were traveling internationally, which is prohibited at this stage, you will have to indicate further as to where you went. We will come to that. If you travel domestically, we will ask you which province. You will indicate Mpumalanga, or you will indicate according to where you went. Wherever you might have gone, it is important that you indicate properly. The mode of transport you used, did you go by bus or your own car or air transport or other? If you have gone internationally and you say bus, there's no way you could have, well, probably you might have. But if you have indicated air transport, it will open up further questions below. Now, Having said that, I did not go anywhere. So I did not travel. The second question that comes is, did you have contacts or visitors from elsewhere? And if you have had, you will say yes. You will then have to answer, did any of them travel from far? The answer is yes. Please provide their name, their mobile number, and their address. This is basically to ensure that should it be that they have been part of a contact tracing system, we can pick it up. Or should it be that at some point you convert, we will also inform them. So it works both ways. But as you add them, look at what it does. It allows for us to know which province they came from. If you have not had any visitor come to visit you, you will indicate a no. Then it will not ask you any further questions about your visitors. The next thing that it is going to ask is there where you stay or within your social circles, where do they come from? Well, where are you? You will indicate the province, the contact type that you have had. What we are asking for here is simply to ask, did the people you hung out with have suspected COVID-19, or were they confirmed, or they were people who were sick but didn't know what they were sick of, or they didn't have anything? The same goes for the people you live with. Do they have, are they suspected of having, or are they just sick from something they don't know? You indicate. The next question being the type of events you were at during the time you were off. Were there people who had suspected COVID-19 or confirmed, or people who did not have any confirmation but had unknown sickness, or it was a large event with many people, or none, or you might want to indicate other for the event that you attended. It is quite important to understand that this is again for us to assess the risk. You will then have to go and fill in the next section of the form, which is asking you the clinical history of exposure. Now, the question is, are you a person who has chronic disease? If the answer is yes, you will select. If you don't have, you select none. If you have on the list conditions which you do not have, but have others that have been left out from the list, you will click other, and then it will open up for you to indicate which chronic disease you have. Then we will ask, or we ask, the recent within the past 21 days of hospitalization. Did you have hospitalization? Yes. In the place you were you having any people who had confirmed cases of COVID-19? If yes, you say yes. Confirmed cases were there, or suspected cases were there, or none or unknown cases according to your recent hospitalization. If you have not been hospitalized, you will indicate no. It is important to bear in mind that this you will fill according to your applicable information. Someone would ask, why are we asking all these questions just after 2 days of being off? Yes, indeed, you're correct in asking that question, but we need to know. And also we need to ensure that there is consistency of information, because from 1 week to the next, no 21 days have elapsed. However, we need to ensure that there is consistency in the questions that you have answered. We then are going to ask the symptoms of what you have. Remember, we have spoken about the fevers, the chills, the sore throats, shortness of breath, dry cough, smell or taste loss, muscle aches, or headaches. In this case, you just answer yes or no. We are considering putting it as a checkbox to make it quick. If you have answered yes to the chills, it asks you, do you have shakes with those chills? Do you have a sore throat? Do you have dry cough, loss of smell, loss of taste, and muscle aches as well as headaches? You will then be able to give us more information as to what other clinical relevant information you have. Finally, you will have to make a declaration that the information you have submitted is indeed true. Please bear in mind that giving false information is dishonesty, but remember, you're not only endangering your colleagues, you're endangering yourself, because if your other colleague were to lie, they would be endangering you. You need not put falsehoods in the information or in the forms. Now, having said that, this time we have put a verification code. You need to enter that verification code in order to be able to submit this information. Let us go through it one more time. You are from a contracted partner. You are entering this information for work purposes. You are working for that company. You are a non-healthcare worker. Your name is Caswell. Your address is as appears. The next thing is we're going to be able to answer the question. Did you have any travel? No. Did you have visitors from elsewhere? No. Where am I staying? Mpumalanga. In my contact types, no one had or was suspected of having COVID-19. The people I live with, none had any sickness or any unwellness or suspicion of COVID-19. I haven't attended any events. According to my chronic disease exposure, I have none, and I have not been admitted to hospital. I don't have a fever, nor do I have chills. I do not have a sore throat. I am not suffering from shortness of breath. I do not have a dry cough. I do not have loss of smell or taste. I do not have muscle aches, and I do not have headaches. No clinical information of relevance is there that I would like to declare, and I declare all that information I've provided up here is true. I will then enter my ID number, and I then go and enter according to the code that appears to verify that I am human. And once that is done, I click submit. Bear the following. Should there be information that has been left out, it will tell you invalid entries. Please rectify and submit again. It all needs my gender, and that's it. However, it might now say, I need to enter the verification code again. Let's try. Voila. Now, submission has been done. Now, for those that are not contracted, this payment will then have to come up. For those who are contracted, this payment will not come up. So do not worry if you are a person who is under contract. As we move on to the next level, I will put on the next part. So, ladies and gentlemen, this is how you enter credentials according to how you feel on the day, how you feel after having been off. So please bear this in mind. You will need to always do this. I have not seen any questions come through. I have not seen any chats. I have seen a request that says the screen was not clear. But simply because you are a partner, these forms, you will receive them on your emails, because in that way, we can be able to ensure that you can fill them on a daily basis. There is a reference on some emails that have indicated that you can be able to enter the web portal. The web portal is active. You will need to enter accordingly such information as would be applicable to you. However, remember this, the web portal needs you to enter according to the email that you have somehow created. Let us show you how that web portal looks like so that you don't have any problem going forward. It is easy. The app can be found on healthemr.xiteinfotech.com. If you enter that on your web browser, you will be able to see, as I will show you right now, this page. What it means is simply this. You will be able to enter all that information only after you have been activated on this portal. So for those of you who have already registered and have received the email that says, please go on to healthemr.xiteinfotech.com, you need to come here. Bear the following in mind. You need to use the email address that you used as you were registering on the other form. Should this email address be different from the other one, you will not be able to access those records that you have entered in the form itself. So please bear that in mind, because it is quite important. But first, you will need to have the credentials, as in the password. None of you have registered on this, we were able to see. So how do you go forward? You need to sign up. As you sign up, you will enter your name. Please make sure that you enter it as you entered in the form that you used for registration. I entered Casual Nguna. You will then need to ensure that you capture that a security passphrase so that we can be able to see that you are human. It is capital letters. Please be aware that this is very, very important. Capital letters are not the same as small letters. And once you sign up, you will then after receive information accordingly. I have registered, so it will tell me unable to process request, try a bit later. It might be that it keeps giving you that error. Please do not register many times. Once is enough. Upon receiving this registration, you will then receive a confirmatory email in which you will be able to then enter your password so that you can be able to get this part of the sign-in active. And then once you enter the email address, you will then be able to put your password, which will be known only by yourself. And then you will only be able to access records that are applicable to yourself. Thank you very much, guys. This is our web portal for the app. Let us now go back to where we were. So, if you have any questions, please, you are allowed to send them to us via the emails or email addresses that came through with the confirmation of registrations. Should you not be able to, you can also contact your employer and you will be able to get our contact details to send us the requests. However, the easiest email that you can bear or put in mind is admin@xiteinfotech.com. It's admin@xiteinfotech.com. Once you send a request, we will be able to assist you. Please bear in mind that we will be able to do a 24-hour turnaround time. Should we not have responded to your query and you are part of our employee groups, please be able to contact your company representative. We will then be in a position to ensure that we can answer your queries accordingly. As we continue giving you the training, you will get more and more comfortable with regards to the use of some of the tools. Thank you very much. We're looking forward to seeing you next time. If there are questions, we are going to ensure that you receive answers to them accordingly. Also, for purpose of further training, we have uploaded and we will upload this video training session online for you to go through. Thank you once again. See you next time.